to hit record. We are recording and we are saying hello because here we are on Friday, March 27th, 2020 with the online conference with the Ontario Network of CAPC.CPNP projects. My name is Sydney Bell and I'm the program lead for the conference, and I'm really delighted to introduce our first speaker, who is Catherine Mazur, or Cathy Mazur, and she is a nurse practitioner in the Division of Adolescent Medicine and the team lead for Transgender Youth Clinic at Kids Hospital. And so with further ado, I'm going to pass this over to Cathy, who can introduce herself a little bit more and lead us through her discussion on supporting gender diverse children. So over to you, Cathy.
Thank you, Sydney.
Thank you.
And thank you for the invitation and the opportunity to speak with all of you. Hope everyone's staying safe in this uncertain time. I'm always really enthusiastic to share gender development and how to support gender diverse kids. Right now I'm working with the youth clinic, so it's mostly adolescents, but my career has all been in pediatric nursing. So I've been working with children and families for well over 30 years now. So a lot of anecdotal stuff, so I'll try not to digress too much with you guys this morning. We can try and entertain questions. If I see them, I'll try to address them, but I have left some time at the end as well. There is a little bit of repetition in some of my slides just for content, and so we'll just move on through. So I always like to start with a little bit of an overview. I have been an educator in the past at U of T, so we do have some objectives for you guys this morning. So just to understand the timing of gender development, a lot of people really say, how do kids know? How can they be sure? So I think it's really important to know how early some of these things develop. And for you folks working with the little E's, I think it's also equally important because we can really set the tone for a lot of their wellness going forward if we're cognizant of who they are and how they are in the early years. So we'll look at, again, a bit about how gender diversity impacts children and families. I think for us working with kids, we never have one client. We always have the young person and whomever their family is. So I think we're always working with more than one individual usually. We're going to look a little bit at the criteria of gender dysphoria, only because that's the language that we're using now. Not to pathologize any of this, but just so for your awareness, because you will hear those terms. And then a little bit about approaches on caring and supporting young people and families. So I know that we are gathered across all of our glorious Turtle Island, so I welcome everyone from all different territories and regions. I like to acknowledge that where I sit today is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples. But we also know that it's home to many diverse First Nations, Inuit, and Métis people. And I think, why am I starting with the land acknowledgement other than the fact that it's a necessary thing for me? It also helps me to frame my talk with you this morning and my work in recognizing my place of privilege. And I think that's really important. Most of us, many of us are working with marginalized individuals for whatever reason. I consider myself privileged. I'm white, I'm educated, I'm cisgender, I have relative food and job security, all those sorts of things. If you are gender diverse, you are inherently marginalized just from your identity. So I think it's really important that we keep that in perspective and all those power dynamics that we're all working with in all the agencies and the organizations that we encounter on a daily basis. So that's why I do that. So, all right, Sydney wanted to throw some poll questions in to keep you guys awake and engaged.
Yes, I will launch the first poll.
Right, so this is an easy show of hands. How many of you know someone who identifies as gender diverse? Just so I get a sense. And if you don't, that's completely fine too. Or maybe you don't know.
And Cathy, just let me know when you want me to end the poll. And then I think I can also show the results. I think right now I'm just seeing the results of what's coming in. Yeah. There are some folks also answering in the chat, which is great.
Okay.
And I think some folks are raising their hands in as an indicator of positive.
Yeah, it's also based on what device they're using to be
That's
with us.
right. That's right. We welcome all input.
Absolutely. I think that's giving us a good sense.
Okay.
I think, I'd say the majority of us probably do know someone who identifies that way. And then equally many of us don't, right? So 17% don't and 17% not sure. So, I mean, I think that's probably a fair representation.
Okay, great. You were able, so and I've shared the results with everybody too.
Perfect.
Okay.
All right. Okay, so we'll move forward.
Yep, sounds good.
All right. So I'm going to start with a little bit of language because I think it's really important, particularly for the youth that I work with. They're very sensitive to how people refer to them and speak about them and to them. So I want to just clarify a few things. If you look at this slide, this is how most of us were raised and educated, on a very what we call binary way of thinking. So if you look at gender identity, we defined everybody historically as either male or female. Now, I'm talking about Western culture. There's a lot of other cultures that have a very different view of gender. Gender expression, you either presented to the world as a man or a woman, and you were attracted to either men or women, or masculine or feminine. So again, you can see that it was very much one end of the extreme or the other. So what we have learned is that that's not really the case for the majority of the humans on this planet, that there is a lot of range between man and woman, between feminine and masculine, between being attracted to men or women. And so we have some terms for that middle ground where you can see, so, gender queer or androgynous or bisexual. But we know that that's a spectrum. So all of these things are separate domains that make up an individual. So they do sort of influence each other, but they are not tied to one another. So you can be very separate in each of these domains. I'll explain that a little bit more as we go forward. The term queer has been reactivated as a less of a political or negative term by many people that identify in a non-binary way in any of these domains, because that sort of is a catch-all. It sort of covers that. I'm not, this or this. So that's sort of how that comes about. So that's some of the language. So the other language that you'll hear are the terms transgender and cisgender. I mentioned before that I'm cisgender. So cisgender folks identify with the sex that they were assigned at birth. So I was assigned female and I identify as female, so I'm cisgender. If your identity does not align with the sex you were assigned, then you are transgender. Now that's a huge number of different language, titles and identities, but that's the way it's divided. And so I've said this term, so assigned female at birth and assigned male at birth. Those babies didn't decide if they were boys or girls. Someone looked in their diaper and decided that for them. So that's why we say it was assigned to them. So that's the language. And this is non-threatening language, right? So it doesn't say, oh, you were a biological male. We don't really know that, as far as science goes. Or you were, we hear natal female, or originally this, or physiologically that. So there's a lot of different language. So to be sort of neutral and non-derogatory, if you say someone was assigned male or assigned female, that sort of captures that really nicely for them. So gender, we now know, is a spectrum. So it's across the board. It can move around. It doesn't have to be a fixed point. So why I use this slide is because one of the very first non-binary youth that I cared for said to me, you know how boys are blue at one end and girls are pink at the other? Well, they said, I'm kind of purple, kind of in the middle. Some days I'm a little bit more blue and some days I'm a little bit more pink. And I'm a visual learner, so that kind of stuck with me, and that really helped me understand where they are in the spectrum and that it is fluid. So I like to share this slide for that purpose. So I talked about these different domains of identity and expression, and there's a really nice tool, and this is available online. We use it really often in our clinic with youth that are having trouble expressing themselves, or maybe a bit cognitively delayed or young. So you can use this with really young children, and it gives them an idea of where they can put themselves on these lines. So you ask them about their identity. Do they identify as being female or male or a man or a boy or girl? And they can kind of put an X on those lines. This is still a bit controversial among some folks because the term other is, not a positive term, but, we're working on tools. So this is a better one than what we've had before, but you can use this really readily with the young people that you're working with and really sort of get a sense of how they perceive themselves. And that's the most important thing. Being gender diverse is an identity. It is not a pathology. And we really have to stick with that way of being and the way of working with these young people. All right, we're going to throw in one more poll question. So,
hello, I'm here.
all right. So
All right.
At what age does a child have a stable sense of their gender? So you have some options there.
Launching.
Okay. They're getting very good at this, Sydney.
Mm-hmm. Absolutely. Yeah, a good percentage of people have voted, 69%.
Yeah. Okay, I think that's going to reflect our results if you want to share that, Sydney.
Sure.
All right.
Share.
Okay, so we've got a bit of a mix with the majority of you saying 4 years old. That's because you guys are educated to work with young people under the age of 6, so you're on it. Okay, so we'll talk about a little bit more. So yeah, stable. You'll find that stable at the age of 4 is exactly right. A lot of people do think that people don't know until they're much older, and so we'll unwrap that a little bit for you and explain those things a little bit better. Okay, so let's talk about how gender identity forms. So little toddlers, 2 and 3 year olds, are very conscious of the physical differences between boys and girls, right? If they're in preschool, they've got the little room with all the tiny toilets, they know who has a penis and who doesn't. They've been told good boy, good girl for their whole lives. So they have a sense of that, and they know the physical differences. And even before they're 3, they can say, I'm a girl, I'm a boy. Now, some kids will say, I'm not a girl, I'm a boy, or I'm not a boy, I'm a girl. But not everyone does. And this is also really important. Not everyone has this real understanding of their identity super early, with like the age group that you're working with. Sometimes it's later in childhood, sometimes it's in adolescence, and sometimes it's not until adulthood. So there's no right or wrong. There's no right, you have to know by this age. So that's what's also really important when you're working with this population. So, as we said, 4 to 5 year olds do have a stable sense of their gender identity. It's not necessarily fixed, but it is stable. They know that they are boys or girls, okay? So at the same time, they're also learning about all this gendered role behavior. That's what girls do, that's what boys do. That's what, typical behaviors. And developmentally, we know that they tend to migrate to their same gendered peers. Okay, so let's think of a little person who was assigned male at birth, who identifies as female, who wants to go with the other girls and play with the dollies, right? So they wander over. Now, if the other little girls are like, yeah, cool, come on, play with the dollies, we're good. But if they say, you can't play with the dollies, you're a boy, right away, this kid is othered. They were like, well, why can't I? Or they might not realize they want to play with the dolls because they actually identify as female. So you can see some of these disparities and some of these questioning of self, not feeling connected can happen super early. And that's why I really like to talk to folks that work with younger kids so we can kind of pay attention to this. And I'm not going to say that we're going to label this kid transgender, right? I'm going to say that they are identifying more female at this point and want to play with the dolls. All right, we're getting a little bit older now, so we're in the primary grades. So kids start to feel more comfortable with their identity, so they may not be so outwardly, obviously expressing their gender in a certain way. So think of the little assigned females who identify as female, who are all pink and princessy and ribbons and bows. And then when they get into grade 1 and 2, they might not do that as much. They might sort of wear more neutral clothing because they're already feeling, okay, I'm a girl. I don't have to show that so much, to show that to the world. So a lot of times we see that. Now this is confusing to parents because they'll say, but you were such a girly girl when you were little. Okay? We get language like that. So again, it's really helping families also understand the process of gender development and the fact that a lot of it is just exploration of self. So if they feel that their gender identity is different from what they were assigned, this is where the social isolation stuff can start, right? They're feeling othered, they're not feeling connected, they don't know why they don't connect with their peers. I've had youth say to me, I couldn't understand why all the little girls wanted to play with these certain things. I wanted to play with the other stuff. And then later they came out as being male identified. So you can see that it happens super early. Some kids can say to me, I remember when I was really small and they used to say, the boys go to this side of the carpet and the girls go to that side of the carpet, and I didn't know which side to go to. So you can see there's already, at this young age, this feeling of, I'm not sure, I don't really know what's going on. So it can cause distress. So after 8, some more gendered stereotypic behaviors appear. You get a lot of the really sort of typically masculine type behaviors in little boys and that sort of thing. So that's just sort of normal. So, you know, it's this from 8 till 10 where early puberty starts for a lot of folks. Puberty starting earlier now. So for assigned females, chest tissue development. For assigned males, a little bit later, but their body starts to change. So if you have a whole bunch of 3 or 4-year-olds and they have similar haircuts, similar shorts and no shirts, you don't know what gender they were assigned based on their appearance. But when your body starts to change, it may be going in a direction that you do not want. So this causes a lot of distress. So this was why we initiated our clinic in 2013, was to help with some of these youth in early puberty. So I know this isn't directly applicable to you, but you can see how, depending on how they were treated and how they were supported in those early years, how much distress they can be in by the time they hit puberty. All right, so let's talk a little bit more about gender-independent children. So here's this lovely little kid playing with a doll. Is this a boy playing with a doll or a girl playing with a doll? Does it matter is my question. It's a little kid playing with a doll. We get really fixated on behaviors associated with gender. That's coming from us, not from the kid. And that's something that we have to be really aware of. So we use the term gender nonconformity, and anything that's nonconformity sort of implies that you're supposed to act a certain way. So if we're talking about gender nonconformity in children, it's the presence of a gender identity or a role or an expression that differs from what is normative for their assigned sex in a given culture or historical period. And boys playing with dolls is the example. So what we're saying, so this is society imposing on you how you're supposed to behave based on what's in your diaper. You can see how this is why we say that gender is a societal construct, because it is. It comes from other people often. So gender independent children are those that express an identity that is different from what's expected of them because of their assigned sex. They're very diverse, so not everybody is full-on princess rainbows or full-on I only want to play with trucks, etc. But it differs from what's assigned. But it's a strong and consistent identity for a lot of these kids. And it may be a blend of things. It may be one day they express one way and then one day another. And we've had a number of kids like that. And that is so confusing to parents because they're trying to label them from an adult binary perspective. Are you a boy or a girl? Not recognizing that there's a lot of space in there. So this is where some of the distress from parents comes because they don't know what to do. So we'll talk a little bit about how to support that. So let's just be clear to tell parents and family members, caregivers. I know I use the term, all those terms. I always, when I teach nursing, I always tell my students the family is what the child says the family is. So that's my premise. So my language does flip back and forth, but I am cognizant of that. It's not always a biological parent. So gender independent behavior is not an act of defiance. They're not doing it to piss somebody off. They're doing it because that's who they are. It's not caused or influenced by parenting style. It can be supported and distress can be lessened by parenting style. It's not caused by abuse. It may feel, children may feel safe to express that. I just met with a young person the other day who said, well, around the time I was 4, I said I was a boy, but nobody listened. Then I said it again when I was 7, and they just brushed it off. So kids are testing. A lot of kids will come out and say, I'm non-binary on the road to being male or female, right? Because they have that middle ground. Not an uncommon thing. Young people don't want to be labeled. So a lot of times they'll take the middle ground so that they have some space to move because they know that there are expectations on behavior with the labels, so they don't necessarily want to be pigeonholed there. And societal stigma is a huge barrier to service. You can see lots of information about how trans folks, LGBT folks, but particularly trans folks, have real huge barriers in access to healthcare in particular, to social services, et cetera. So, you know, the more and more we can break those barriers down, the better for all of us. It's a really busy slide, but don't worry about it. So this is the actual criteria for gender dysphoria in the Diagnostic and Statistic Manual, version 5. And now if in version 4, we used to call this gender identity disorder. So that was even more negative. We don't like the term gender dysphoria, and we're really trying to move away from that to more like gender incongruence, so it doesn't really line up. But this is the language that we are using now, and this is the language that we need to use for gender diverse folks to get healthcare in particular. So you can look at those sorts of things, and we can see, so, you know, point 1, a strong desire to be the other gender. In boys, a strong preference for cross-dressing. In girls, a strong preference for wearing typically masculine clothing. So even these definitions are binary. They're making assumptions about what masculine and feminine clothing are. So you can see we're already getting into some trouble with this language. Number 3, a strong preference for cross-dressing and make-believe play or fantasy play. So this is where you may see in the little kids, the little assigned boy that always wants to wear the princess outfits, or the little assigned girl that always wants to wear, the typically male construction hats or whatever you have in your toy bins, so that you can see that kind of happening. This is also testing out the waters and figuring out who you are. And imaginary play can be imaginary play, doesn't have to be related to gender. So that's why it's confusing. So we need to sort of watch and support the kids in who they are without labeling them as being definitely trans. There's a lot of variation in young kids about experimenting. So again, all these points, a strong dislike of one's sexual anatomy. I hear lots of stories of young kids who try to remove their body parts, or they aren't self-harm because they don't want a penis or they don't want chest tissue or whatever that is. So that is real. That does happen. Not a lot, but it does. And so that's their level of distress with how their body is. And a strong desire for primary or secondary sex characteristics of the experienced gender. So I'm assigned male, but I want to have breasts. I'm assigned female, but I'd like to have a penis. And some kids do articulate that before the age of 6. The most important piece on this slide for me is B, that this condition is associated with significant distress and impairment, either socially or in school or other areas of function. And that's the thing. And that's what I say to young people. We need to give you this diagnosis and you do meet the criteria. For me, it means that your body doesn't align with who you are and how you are. And we're trying to fix that for you and make you feel better. So that's how we summarize that. But it's important to know that this language exists and to be aware of it. Right. So there's an organization called the World Professional Association for Transgender Health. And this is sort of the overview from the chapter on children and youth on what we need to do to take care of transgender youth and kids. So it doesn't really matter about all these things. We talked about diagnosis, counseling if they need it, treatment options. And then these are more older kids, but I think what the most important thing on this whole slide is affirming sense of self. So that's what we'll talk about. And all of us can do that. You don't need a medical degree or a nursing degree or a PhD to be able to affirm someone in their identity. So I think that's what's really important on this slide. All right. So what's the prevalence in adolescence? The most recent data, when we started doing our work, it was like 0.2 to 0.5% of youth identifies transgender. And actually it's much higher because we're asking more now. So this is 1.2 to 4 of adolescents say that their identity is different from what they were assigned. And even in Canada, the youth that identify as transgender, 41% say that they're non-binary. So even in a transgender identity, they're not 100% male or 100% female, right? They're somewhere in that spectrum in between. And the only reason I'm showing you this is because all of these youth were once gender diverse children. So that's why, so you can see that it's a process. Another study, again, this just shows a huge percentage of young people don't identify 100% male or female. The numbers are not relevant. My point is that they are not, there is a spectrum. And then now that we're asking youth about their identities, they're able to articulate that, and we're starting to see that more. So gender variant identities. Now this language changes on a fairly regular basis, as you'll learn if you're working with this population. So this is just a non-exhaustive list of some of the terms that I've learned from young people about their different gender identities. So what's important about this? Not that you have to understand all these things. Ask them what it means to them. Oh, so you're a demi boy. What does that mean to you? Well, that means I'm mostly boy, or demi girl, I'm mostly girl. So just ask. I do that when young people are telling me about what substances they're using and I don't know the language. I ask. So that's important. What's also important about gender identity? The only person that can speak to their identity is the individual or the child. None of us can speak to anyone else's identity. Nor should we be expected to understand what it means to be gender diverse if we are not. I don't know what it's like to be male in a female body, and I won't. And this is what really important messaging to parents. You don't need to understand the gender diversity. You need to accept this is who your child is, and you need to support them in that identity. So that's some of the messaging that we use. All right, so some considerations again. So the summary, personal, potentially fluid, we talked about that. Expression and identity do not always align. So I may feel very female, but I will dress continuously in my assigned masculine gender because of safety, maybe because of level of comfort, level of anxiety. So we don't expect someone who's dressed a certain way to be a certain gender identity. And we do that. We always go binary. Oh, that's a guy, that's a girl. So we really have to sort of question that. And now that I work with in gender all the time, it's like it's everywhere. Everything's very binary. The level of distress is personal. It's like someone's trauma. I can't say to you that's not traumatic, nor can I say to you that's not causing you dysphoria. So again, it's individualized. And we should never hold care if someone's not coping. Mental health and gender care have to be done simultaneously because they feed off of each other. So we don't withhold one over the other. So what's an affirming approach? So this is the approach for children prior to puberty. There's no medical treatment for a young person before they start puberty. So the affirming approach is what there is, and all the literature supports it. So these are the points, I guess, for you guys to try to think about. Give them a space to explore without judgment. Follow their lead of their self, and it may move around. Support the family to support the young person. Changing that kid is never our goal. It's figuring out how they are and helping them to express themselves. Really well supported by all the literature, lots of studies now from the Canadian Pediatric Society, the American Academy of Pediatrics, the American Psychological Association. All those huge agencies do support the affirming approach for children with better mental health outcomes. So within a family, we have to destigmatize gender variance. So there's a lot of cultural, family, religious implications. So we really have to sort of take that apart for folks and help them understand that it's not, again, it's not a pathology, it's who the young person is. And while doing that, really promote their pride and self-worth. We want healthy, confident young people. If you're questioning your place in society, your place in a group, your place in the circle of friends, that impacts that. So we really have to support that. And always working to strengthen the child bond. Now, there's no age of consent for healthcare in our province, and varying across the country. So young people that I work with can consent to all their medical treatments on their own if they have capacity. But I work with families because I knew young people always do better with families. And I know that's the work that you guys are doing too. Working with young families, working with young moms, all those sorts of things to really support the child. And then trying to connect to peer support, both for the family and for the young person. You know, little kids don't need to, go to, adult or adolescent support groups. They want to have a picnic with other kids that are like them or have a barbecue. So it's really a community that they seek, and then helping them find that's really important. So one of the really important things is to use someone's chosen name. And we have been saying that from the beginning of our clinic, but we have literature now that shows that if someone is addressed by their chosen name, that it decreases suicidality, it decreases depressive symptoms, and the contexts that they refer to are at home, at school, maybe at church. So again, so those contexts, those everyday contexts, so really important. So if a little kid says, I don't want to be called Susie, I want to be called Jimmy, it doesn't cost anything to call them Jimmy. And I'm not saying the parents should run out and change all their birth registration and all their documents when they're 4, but you can call them by the name they prefer to make them feel comfortable. And I think that's just being respectful. You know, a lot of people don't use the names that are on their birth certificates, and we call them by their preferred name. Same thing here. So I think it's just something that we could do that is supportive of kids as well. So what are the role of care providers? And I know there's a bunch of different providers and you all have sort of different disciplines, but this is sort of the overview of what we try to do at our clinic and what we try to role model and teach. Is kind of a gender neutral environment if possible. So instead of having the boys' toys and the girls' toys, just maybe mix them up, little things like that. Trying to support that affirming approach. If young people need counseling, then we get them counseling. It may have something to do with gender, but it might not. There's a lot of young people that have anxiety and depression, as we all know. There's a lot of gender diverse young people. Where those two places mix is really, really messy for them sometimes because they sort of feed off of each other. If you already have social anxiety, and you have gender diversity, you can see it's going to be really hard for you to go to school, really hard for you to go and interact with other people. So again, really important. So education, advocacy for training other providers, helping understand and navigate the system, which is very complex, and connecting to community. So this is sort of a summary of all the things that I've kind of mentioned in the last few minutes. So what can we do for environment? It really depends on where you are. Obviously, in our clinic setting, we really try to address things like putting preferred name on charts, having little stickers and things. I don't know if you can see my lanyard. I've got, I have a pronoun button that says she, her on it. I have all kinds of rainbow and trans things. Just having a rainbow sticker somewhere is a signal to gender diverse or LGBT folks that it's a safe place. And you're also working with gender diverse parents, right? A lot of gender diverse folks are having babies these days. So just that welcomeness of having that little sticker or something somewhere is really important. Some places have huge, gender inclusive or diversity inclusive statements on their walls, and that's fine, but I'm just saying there's little ways you can start with some stickers and things. Rapport is important, how we interact. So we've mentioned many of those things before. For youth, we label them as the expert of their gender. So I think children, you can do that as well. They might not have the words to say how they feel, but, you know, just go with it. You know, I had a parent call me and say, oh, you know, I think his child was maybe 8, and said that the assigned female she wanted was a boy. And the dad said to me, but I keep saying, but you're such a pretty girl. I said, you need to stop saying that. You need to say, okay, this is who you are. How can I help you? Or what do you need from me? Right? And so every time you misname someone or mispronounce someone, that's what we call a microaggression. That hurts those kids. It's not just an oops, oh, sorry. But if you correct yourself, they respect that. So you don't have to be right all the time. You can ask, what pronouns do you use? How do you want to be addressed? So those sorts of things as well. By the time I see these kids at adolescence, they may have had a lot of really negative experiences. So really to factor that in, what have been their previous experiences with healthcare, with the school system, with social services, et cetera, around their gender. So keeping that in mind is really important. The first thing we do when a child presents to our clinic for the very first time is, what name shall we call you and what pronouns do you use? Right off the top, so they know that we're aware of that. We want to respect them. You can put stickers and things around to support that. Obviously, that's another way of being welcoming. All right, so let's talk about families, because you're all working with families. So a young person does not, or seldom, transitions on their own. The whole family has to transition. So they have to work through these things. So there's a lot of different reactions that we see from care providers. They may really be struggling with their own transphobia. They may have been gender diverse. I hear lots of stories about the things they went through in college and all sorts of stuff. So you have to give them that space. They may be ostracized from their family if they support their kid. So there's lots of different ways of being there. Give them some space to articulate those emotions, their fears. Okay, so a lot of these parents, now think of folks that are from an adult lens. So a little kid says, I'm a boy or I'm a girl, and they're already down the road. They've already got them on hormones and having surgery. You got to rewind them to the present. Right now, you've got a 4-year-old that likes to play with dolls. Let them play with dolls. That makes them happy. What's wrong with that? Don't assume that means you're going to be a trans female or a trans male. So we make a lot of assumptions as adults. We put our adult brain lens on kids all the time, and we've got to dial that back and help parents do that as well. So fears for safety, parents are terrified. They see stuff in the news all the time about how horrible it is for trans folks. There's, you know, Black trans women in the United States are murdered at an alarmingly large rate. So that's in the news. So people see that. So they're fearful. And that's okay. So acknowledge that. Give them that space. Give them that space to mourn the loss of who they thought their child was going to be. They didn't lose their kid. If anything, they're going to get their kid back if the kids wandered off in distress. So give them that space to do that. Really important. Support parents and caregivers as well. There's peer groups. There's some other resources that I'll share with you. The children seldom need counseling. If they need counseling, most often it's because they have another underlying mental health concern. So maybe they do have, anxiety in early childhood. Maybe they do have OCD traits or something like that. So really important that we keep it in mind, but don't say it's causal, because it's not. They influence each other. So a lot of little kids, just like I said, they want a barbecue and a picnic. They don't necessarily need counseling. And really follow the child's lead. Hugely important to do that. So the Trans Pulse, there's a new study going on right now across the country. This is a group of researchers that does some really great work with LGBT folks, particularly around youth. But this results came out 2014, and you can get all these information online. It's a really great report. I just pulled out one of the graphs from that report to show you the difference between outcomes in mental health for young people that are supported and affirmed in their gender and those whose parents do not support them. Look at this, hugely different, huge difference, particularly in suicide attempts. The interesting thing is that they found that parents that are somewhat supportive and not supportive at all had very similar outcomes. So those parents that are kind of apathetic, like, oh yeah, I'll take you to clinic, but I'm not going to call you by your chosen name, that's equally damaging. So that's another sort of messaging point. And I do reference these kinds of studies and things often when I'm speaking to parents. We know that, studies show, etc. So I think it's really important for us to know that. So how do we support parents? Again, make room for their failures or sense of loss. Help them find supports, families like theirs, and find out what can they do. So I don't expect them to necessarily change the kid's name legally, like I said, but they could call them that at home. When they start to have this, you can wear the dress at home, but not in public. Again, there's that why, there's that shaming. So really important messaging on, like, if you're going to support a kid to be who they are, then they should be who they are in all situations and scenarios. And that's hard for families, and sometimes it might not be safe. So just trying to negotiate that. What could you do? Or what are some baby steps? You don't have to full on be at the head of the parade like this parent here, but what are the little things that you can do in the interim? Some really good resources. This Families in Transition Guide is amazing. This is a second iteration. You can download this. It is available online from CTOIS. Central Toronto Youth Services is one of our community partners here in Toronto. We work really closely with them. And so a great resource. And we give this out to everybody. Back in the day, we would print it and hand it out, but now you can download it, you can print it, you can give it to families. There's a really great section in there that's 20 things I'd like to say to my parents that was developed by trans youth, and it's very informative. There's other things online, the Family Acceptance Project. So this is a nice one that's also available in a number of languages, and it has some faith-based resources. So if you have like very strong religious faith, that can help with some of the languaging. So that's a really nice resource for you guys as well. Community agencies. Now this obviously is very Toronto-centric, but these are all the agencies that we partner with. I have a very small team in my clinic, and we focus on assessment and medical treatment around transition. So all the psychosocial groups, the mental health supports, our partners do that. We don't do that here. So we partner with a lot of folks to know what's what. Probably what's most important for you guys is to know about is Rainbow Health Ontario. So that's sort of the Ministry of Health repository around health for LGBT folks, mostly older. But the TDSB, the Toronto District School Board, has a gender-based violence prevention team. And on their website, they have resources, how to be affirming in the classroom and how to be affirming in schools for children and for teachers, for example. They have a group that they run for little kids. There's the 519 Community Center here in Toronto did have before our COVID pandemic, have monthly sort of drop-ins for gender diverse families. So again, you can meet other folks. So again, there's definitely things, and I know there are things in many communities across the province and across Canada now. So Google helps, or if you know of an agency that does LGBT work, often they know who the other partners are. So connecting with them can be helpful as well. And most of them have pretty good websites too. Parent support. So PFLAG is a Canadian-wide organization, and they will support parents in early stages when they're having lots of questions as well. There's usually local community chapters, and they meet for coffee. Some parents that are not quite ready to go there find this group a little bit too sort of political or active, or so that might not be, if you don't want to go in person, that might be a bit much. There's a Facebook page for Canadian parents of trans kids. There's 1,000 members across the country. It is very well moderated. There are a number of folks on there that are psychologists that are either gender diverse or their parents are gender diverse kids. So this is a very supportive place. A lot of people have found to ask their questions, particularly in early stages. So that's a nice resource. Some great websites that are on here. Gender Creative Kids. It's all together. I separated the words so that you could read them for the slide. And Gender Creative Kids is web page that's moderated and maintained by parents of gender diverse kids out of Montreal, I believe. And mykidisgay.com. I got really crazy about the title, but that organization does amazing work around how to talk to families, how to talk to parents when their kids are presenting as LGBT. So they've got some really good, thoughtful, very affirming ways of being on that website, and they're on social media as well. There's 2 books that I've listed. One is by psychologist Diane Ehrenschaft, who's very, very prominent in working with gender diverse children. I think this is probably the 2nd and 3rd book. She's also working on protocols and guidelines. And more recently released is an author from Ottawa who is a partner and a parent of a gender diverse individual. And this is her story, and this has gotten really good reviews. And Amanda Jetnox is very active on Twitter as well, and a huge activist. So that's a really good resource. And both gender diverse folks and their families and their partners find it really helpful. So there's some resources for you there. All right, this is just a slide that shows all the different people that are involved. The ones on the left were all the different clinics that we visited before we even opened our clinic to see how things were run for them and what worked and what didn't. And then the ones in the middle and on the right are all our partners. So it takes a village, as it always does, to raise a kid. And a gender diverse kid is no different in that. They might need a little bit more unique approaches, but definitely we work together to do all this. And that's why I do like to share with whomever I can and tell my little messaging to everyone else. So the summary, the principles of care, and these are from a learning institute that I did with Rainbow Health Ontario a few years ago now. Again, I've said most of these things already. Diversity is not a pathology. Consider minority stress. Many of the folks that we are working with suffer from minority stress for lots of different reasons. Be trauma-informed. Gender is self-determined. Respect name and pronouns. Informed consent, always. We all do that. Advocacy, we do that well. Consider non-binary identities. Again, so not male or female, everywhere in between. Working with families to strengthen the bonds, to support the young people. Building resilience. You know, most of our clients are resilient. They have gotten through a lot of diversity, so really supporting that. And the most important thing I think on this is unpacking one's own bias. If you're having problems with this work or problems with that, ask yourself why. Is it because we're afraid of gender? If you don't think about your gender, you'd never think about it. You take it for granted. So thinking about that, I think, just is a bit enriching, just to know that there's such a variety, a wonderful variety of human beings on this planet. And we don't have to label them in little boxes. We can just let them be and really support them to be. And then they'll grow and they'll be great humans. All right, that's the content that I have. And I think I have left a few minutes for some questions.
Hey, Cathy, this is Sydney.
Hello, Sydney.
Hello. Yes, we do have time for questions, and there were a few that popped up as you were chatting. And I think the first one that I noticed, there was a question around affirming, how can we affirm gender in our practice? And the person who posted it did acknowledge that she felt you did start to address that question after she posted it. Okay. But I thought I would bring it forward again just to see if you had any, again, with that sort of that lens of the, early years that those of us in CAPC.CPNP projects work in, so that affirmation piece. Do you have any sort of additional thoughts on that?
Yeah, I mean, I think from the parents that I've spoken to with younger children, it's really telling them to calm down a little bit. Like I said, a lot of times they're jumping way down the road and their kid is just exploring. Just because, and I think looking at context. So a really good example. So a mom called and said that their assigned male kept saying that he was a girl. And then as we were having this conversation, the mother acknowledged that this was a middle child, that the older child was, and she admitted it, her favorite little girl. And so this little boy knew that. And then she was pregnant with a third child that was another girl. So a 4-year-old might just think, mommy will love me better if I'm a boy, or a girl rather, right? I mean, that's possible. So again, understanding that just because a young person is saying they're one way or another, let them be that. Don't question why they're that. So the affirming piece for little kids is really is following their lead. So if they want to play with certain toys, to let them, to not assume that they're going to be trans. The majority of young people that show gender diverse behaviors before puberty are not transgender. They're just showing gender diverse behaviors. Right. If they present in adolescence, those are the ones that 98% of them will proceed to some sort of a transgender type identity.
Right. Right. Thank you. Another question was, if I'm a friend of a parent who has a gender diverse child, how can I best support them?
Give them that space. Maybe you're the person that they can articulate their fears to, or ask them, how they feel. And again, then bring them back to the present. So if their child is gender diverse in the early years, then support that and follow their lead. But if it's later and they're distressed, then maybe helping them hook up to resources, maybe some of those family groups, like the parent group, or looking at the PFLAG stuff, or even looking at the Families in Transition book. Giving them those resources so they can do their own research to understand what gender is and see how does that apply to my kid and how to support them. Parents are very brave in front of their children, even with the adolescents, and then sometimes you get them alone and they just fall to pieces because they're terrified. So just like I said, giving them that space and supporting them, and that's real. And and I had a dad say to me, thank you for just letting me say that. I said, absolutely. Everybody's in a different place.
Thank you. Another question was, how about the term bi gender? Did that?
Oh yeah, that's another. It's another term.
Yeah.
It's bi gender, non-binary. So they're a bit of both, right? I mean, I think that's the point. Is that kids will find a term that resonates with them, and then they'll use it, and then they might change it. I've had in the course of knowing young people for a few years, as they go through adolescence, if we see them earlier on, they change their names. They try one that doesn't work. They try another one. They might change. Okay, well, I'm trans male. No, I'm non-binary, masculine. So the language really is how they define themselves.
Mm-hmm.
And so asking them what that means or how do I support you in that identity is probably the easiest way to go.
Gotcha. There are a couple of questions around resources and around your slide deck and how it will include a PDF copy of your slides in the resources package. So I think that will address some of that. There is a question, are there any resources that address not only the LGBTQIA community, but within a multicultural sensitivity? Often in a childcare community, there is a cultural sensitivities that may hinder the LGBTQIA context. Does that make sense?
Yeah.
Question?
Yeah, I mean, that's real. I think it's interesting, but this is another thing that sometimes we make assumptions about. We met this a new patient the other day who is from a very obviously practicing Muslim family, and they were one of the most supportive around this kid's gender. They just love their kid and they want them to be healthy. So I think it's finding out where the community leaders feel. For example, if I'm working with Indigenous youth, then I often say, have you spoken to an elder? Is two-spiritedness something that your people actually aspire to or acknowledge? Because not everyone does. So finding out where their cultural beliefs are and where are they stuck. So some of those resources that are specific to other cultures, or even mykidisgay.com, they've addressed that. And a lot of the priests and reverends and folks that I have spoken to over the years are really trying to stay away from saying that it's wrong, because they don't know that it is. I mean, there may be Bible or other literature in their cultures that support not being a certain way, but most of those documents were written in certain periods of time and very historically long ago. So it's really finding out where can they support them that fits in with their faith, but still supports their child. So sometimes it's maybe taking that apart a little bit to understand that, and I guess the other thing too is that families often assume that their children are going to end up being the faith that they are raised in, and they aren't always. So, it's finding that sweet spot on where can we support your young person, but it still goes with your faith. So there's no sexual activity. We're not doing anything with children that's going to permanently change them. We're not giving them medications. We're not signing them up for surgery. We're just, acknowledging who they are. So again, maybe unwinding that back to it's an identity. Sort of.
Oh my goodness. Thank you so much, Cathy. I'm just going to hop back here on video with you. And I just want to extend my gratitude and gratitude on behalf of everybody here for your time and for leading us through such a really sort of thorough and clear sort of picture of how we might be in a place to better support families with children who are making these explorations. One thing that really stood out for me, for you, when you talked about our tendency to impose our adult lens on children, and I think that's just a really good thing to be aware of, right? And to look to check, along with our other biases or fears that we might have. So, and I want to thank folks for your questions for Cathy. That was great. And I guess we'll be wrapping this session up now and bidding you adieu, Cathy, and wishing you a wonderful rest of the day. And for our attendees, we'll be moving into a break for a few minutes and getting set up for our panel. So thanks again, Cathy, and it was a pleasure, and I hope our paths cross again.
Yeah, absolutely. Well, thank you very much for the invitation, and stay safe, everyone.
Thanks. You too.